Today we'll be talking about placenta previa, a condition where the placenta blocks the opening of the uterus and it might not allow the baby to be born naturally. Placenta previa is a medical condition that happens during pregnancy when the placenta partially or completely covers the cervix, the opening to the uterus. Normally, the placenta is attached to the upper or side walls of the uterus, but in cases of placenta previa, it is located lower in the uterus. There are three types of previa. The first of placenta previa is marginal previa. This is when the placenta is at the edge of the cervix and it's not really obstructing the way to the birth canal. This condition can sometimes resolve itself as the pregnancy progresses, but it still requires monitoring and medical attention. The second type is partial previa, when the placenta partially covers the cervix. The good news is it can resolve as the pregnancy progresses as well. The placenta may move away from the cervix as the uterus expands, although it's not always the case, unfortunately. And the third one is complete previa. This is when the placenta completely covers the cervix. Now, depending on how severe the placenta previa is, your doctor will recommend bed rest or hospitalization or a C-section delivery to avoid complications during childbirth. There might also be activity restrictions, such as restrictions on strenuous exercises, heavy lifting, and sexual intercourse. And you will be monitored closely throughout your whole pregnancy. Obviously, placenta previa is usually detected during your routine prenatal ultrasounds. For example, I had an ultrasound, I think, every month in the beginning and then every other month in my second and third trimester. So if there's placenta previa, your doctor will see it during your routine checkups. The most common symptom of placenta previa is painless vaginal bleeding, which usually happens during the third trimester. This bleeding can be sudden, heavy, and painless. But of course, if you are having regular checkups, it will be detected way before that. What are the risk factors? If you had C-section previously, that can be a risk factor. Multiple pregnancies, twins or triplets, a history of placenta previa in previous pregnancies, and smoking. Unfortunately, placenta previa cannot be prevented, but taking care of the risk factors, smoking, is always a good idea. At the end of the day, with proper medical care and monitoring, most cases of placenta previa result in safe delivery and healthy baby. However, specific outcome can be different depending on the individual circumstances. If you suspect you have placenta previa or experience any vaginal bleeding during pregnancy, it's very, very important to contact your doctor immediately for proper evaluation and guidance. Okay, so I have already shared the most important information that you should know, and now I want to go more into details of what specific danger does placenta previa poses, but you don't have to watch it if you don't want to. Okay, so placenta previa can be a serious medical condition because in the third trimester, the cervix begins to thin and dilate to prepare for the upcoming labor. And the placenta, which is located on the cervix or close to it, might tear or rupture blood vessels nearby, and this might cause severe bleeding, which can put the mother at risk of hemorrhage, which is a life-threatening condition. Severe bleeding may require emergency medical intervention, blood transfusions, and in rare cases, a hysterectomy, a removal of the uterus to control the bleeding. In this situation, the baby is also at risk. Prolonged and severe bleeding can lead to fetal distress due to decrease in oxygen supply. In some cases, early preterm delivery via C-section may be necessary to protect the baby, and in turn, preterm birth can increase the risk of health issues for the baby, including respiratory problems, infections, and maybe developmental challenges. Plus, C-sections carry their own set of risks and potential complications, although they are generally safe. This is all I wanted to share about placenta previa. If you have any concerns, talk to your doctor, and I'll see you next time.